All right, good afternoon and welcome everybody. Thank you so much for attending our presentation and discussion on understanding technology as a social determinant of health. We are happy at the Healthy Aging Collaborative to co-host this presentation discussion with the Executive Office of Elder Affairs, and you'll be hearing from Robin Lipson in a moment. We are going to also be hearing from Babson College that did some amazing work and listening to communities and stakeholders on the digital divide and the impact on older adults. And we'll be hearing from folks working in the community themselves, from Little Brothers Friends of the Elderly, from Friendship Works, and the Age Strong Commission. We're going to start off just by presenting just some framing of how we're thinking of this issue and why this has become such an important focus for folks across the board, but also for us at the Massachusetts Healthy Aging Collaborative. So just to introduce ourselves, for those of you who don't know, the Mass Healthy Aging Collaborative is a cross-sector network. We promote and support inclusive age and dementia-friendly communities. And, we bring together folks from all different sectors, organizations, and communities to support cities, towns, regions, and a statewide initiative to make our environments great places to grow up and grow old. So we're going to dive right into this, and just want to also say that we have a Q&A function that's open. We'll be hearing sort of a panel discussion after the presentation, and after the presentation by Babson College, I should say. And if folks can stay on for a couple additional minutes, we'll be able to turn off the recording and have take a few questions after that if folks have time. You'll also be getting an evaluation form that will have forms and fields open if people are interested in staying in touch about this issue and interested in sort of getting involved more deeply about it. So we can move on to the next slide, please. So we wanted to start off, obviously, looking at the social determinants of health for this issue, and the fact that technology, internet access, and affordability impact nearly every social determinant. So what we try to do at the Mass Healthy Aging Collaborative, and it's part of the age and dementia friendly movement, is really connect and bring together representatives of all the social determinants of health to move and advance the age and dementia friendly movement. So if we're looking at technology and the role of technology that's playing even before the pandemic started, but certainly the pandemic has brought this way above the surface and prioritized it in a really significant way. This can either be an equalizer across communities or can exacerbate current inequities. So what we are looking to is the crossover and overlap technology has between all these social determinants and how it impacts people's access to health and wellness, to social interaction, even accessing transportation and other things. So next slide, please. And in looking at the age and dementia friendly framework, it's the same thing. While this framework sort of reflects the social determinants of health, we can no longer sort of look at this framework without also thinking about the role of technology. And communities have responded in a really big way and adjusted in a big way to help support people of all ages, particularly older adults. But technology plays a role in all of this. And if you kind of dive into the resources and what the World Health Organization, AARP, puts out there, technology has been tucked in the communication and information domain or issue area. But again, technology influences everything on here. You can look at public safety and concerns around privacy. You can look at housing and whether we have public housing that is ready to be connected to help people living in affordable housing of every type and connect people living in those settings, and so on and so forth. But technology impacts all of these sectors and more. And so this is kind of why we're talking about this, and I want to present this frame as we move forward. So next slide, please. One resource that's come out that we've been talking about in our world is it's the little things. It's a report that came out of an ARP and UMass Boston work group to address social isolation and build community. And as part of a round of community listening sessions across the state earlier this year, we have this report with 100 examples, 100 plus examples of how communities and community-based stakeholders have addressed loneliness, social isolation, and really connected different generations. And so there's a whole section on internet-based innovations, and I invite you to go in, take a look at that. It's on UMass Boston's website, it's on our website. And while this provides some examples, we have certainly more work to do to look at accessibility and affordability, access to devices, literacy of using those devices, and how we can bring together different groups within the aging services sector, but also outside of the aging services sector to address this issue. So I'm going to turn things over to Robin Lipson to give her perspective on this, and to also introduce the Babson College team that will present their research and work. So thank you, Robin.
Thanks, James. Good afternoon, everyone. It is great to be here. Welcome to my very messy desk. I meant to take a minute to neaten things up for you, but I didn't get there. So I think, as James pointed out, the pandemic has really shined a very, very bright light on the importance of technology as a means for older adults to engage and to get through their daily activities. And I want to give you a little bit of context. When we started working on the Massachusetts Age-Friendly State Plan 3 or 4 years ago, and we toured around the Commonwealth listening to people and what was important to them, paramount for folks was the ability to age in community and have the resources to make their own decisions and choose the services and supports they need. But the other two things that came up all the time were access to transportation, which was kind of code for what do I do if I stop driving, and housing, access to affordable housing. And it's not that those concerns or priorities have receded, but I think we lay technology on all of them as a means for people to remain independent and engaged. So the pandemic's really heightened the importance of technology for all age groups, but especially for older adults as we think about the relationship between loneliness and isolation and your ability to engage. So it has newfound importance for us. So that's kind of one piece of context. The second piece of context I'll give you is that as we worked through the Governor's Council's recommendations around aging in Massachusetts, one of their recommendations was that we should engage in this work with as many sectors as possible. So it wasn't just about all the aging folks working on this. So we developed strong relationships with philanthropy, with academia, with the business community, with the technology community. And I think for me, the biggest learning here is this is about a large part of our population. This is actually about all of us. We're all aging. And this is everyone's work, not just the work of people who work in aging. So when Cheryl Kaiser, my colleague from Babson, called me about 15 months ago and said, hey, Robin, you know, we have this opportunity to work with the Toyota Mobility Foundation. We've decided we want to work for a semester or so on mobility in older adults. What can you tell me? We had a nice little chat. I thought I was just giving her context and background. And that was really the beginning of a wonderful partnership with Babson and with Cheryl and her colleagues, including Sanan, who I'll introduce in a moment. So our first work with Babson was about a year ago on mobility. And I would say that what was really energizing for me was to work with a team of students and watch them look with very fresh eyes at the aging space and the issues. Their dedication and intellectual curiosity really drove the work on this project. And they had great insights, great results, and great recommendations. So after that work was completed, and as the pandemic kind of unfolded, it became clear that there was more work that could be done. And Babson came back to us again with this idea of a challenge to address the topic of mobility to a virtual space, and to ask how older adults could remain, quote, air quotes, mobile in their communities from home. And this led us to the work that Sanan's going to share, where the students explored issues around technology access and equity for older adults. So what we're going to do this afternoon is I'm going to have Sanan Erzurumlu. I always have trouble pronouncing his name, but I'm getting to the point where it almost rolls off the tongue. Where Sanan, who's a professor of innovation and operations management at Babson, Sanan is going to present the work that his team did over the summer. And then we'll turn to some community leaders and bring James back in to have a conversation about what's happened at the local level and several different approaches that community organizations have taken to address these issues. So let me ask Sanan to bring up his camera and his microphone. And Professor, I will turn it over to you.
Thank you very much for that introduction, Robin. I appreciate it. All right. I hope everybody could see my screen now. As much as Robin gave us such great praise, of course, this is a collaboration. This is the result of a collaboration, and it couldn't have happened without the support and the direction of EOEA. And you will see all the experts, and some of them are today at the panel. So I'm really humbled to be presenting in their opinion. And I'm really humbled to be in your presence, a group who cares about social issues and try to do something by even moving it a little bit forward. It really matters a lot. So our work actually with our group at EOEA was this major question on how might we mitigate social isolation, which became even more of an issue at this COVID world for older adults with the equitable technology access and utilization. So our group at FutureLab actually, we like to approach problem solving, starting with this idea formation, but we don't necessarily call it yet ready. We do a lot of ethnographic training, thinking. We go and work with older adults, subject matter experts, and we come back and bring that back into the lab where we do some strategic training, thinking, trying to figure out what solutions would be viable and scalable. So we repeat this multiple times. We learn with the community, then we co-create with the community, and then we test our results with them. So community is involved for us, very dear to part of our projects. Hence, this part you're seeing is where we did a lot of learning. And while we were doing this learning, we were also getting to know both the ecosystem and the older adults. And surprisingly, what we have seen with the work on mobility and what we have seen with the work on connectivity, similar issues, similar sentiments from older adults that we were hearing were coming again. And truth be told, mobility and connectivity are two technologies are really like yin and yang, like they are really driving each other. One without the other would not be complete transformation of the needs for anybody, not necessarily older adults. So what we have heard from older adults, we have spoken with, I would say, not that many, but by the input we got from the subject matter experts, we were really hearing, actually, I think about maybe 25, 30 older adult examples we had on our mind. And we hear things like, of course, internet is expensive. How am I going to deal with that? Then we had things about I want to learn technology, but my daughter and sons, I don't want to work with them. They're not patient. I want to work with my grandchildren. We heard about things about now you're seeing my background. It's not the most background I'm proud about. There were some of them, they didn't even care about the technology. They just did not want to show their background in Zoom, and that was enough for them not to turn it on. So we started understanding what it means to be an older adult, both for technology use and what it means to use that technology, how they represent themselves. So we put a lot of thinking into this. So this actually puts us into, this is the academic side in us, looking at who has studied this problem. And there is a technology acceptance model that puts into framework that if any technology user if they do not perceive a technology useful, or they do not perceive it easy to use, they will not have the positive attitude to that technology. And we heard this from our older adults as well. Some of them were not finding it very useful, although our conversations were really much changing in June to August, and the COVID was nowhere to be gone. It's going to be here for a long time. Older adults were feeling more engaged with trying to learn this technology. But we have also heard from them, like their grandchildren, that their social influence, who's going to be a part of their conversation, matters a lot. And also the facilitating conditions, like older adults they want to learn technology, but we cannot just provide them the technology, but just like we design and offer it to other segments of our population. So with these ideas on mind, we looked around and we said, is there a solution that we can plug and play? Of course, like in 99% of the case, that wasn't going to happen. There are fascinating solutions, like there are AR, VR solutions, there are AI, artificial intelligence solutions, there are iPads that are designed for older adults, there are phones that are designed for older adults. We just can't bring it to equitable because of the cost point of these. What we see, on the other hand, is telephone and public access television is actually very important for some older adults, and that is their connectivity world. So for all the entrepreneurs out there who might be listening to this call, there's a nice gap here waiting to be disrupted. And we were trying to think about this. Can we bring the price point down, or can we find new technologies to bring it up? So we asked older adults, and these are our personas that came out of studies. For example, Marcus Williams is one of our persona. It's a fictional model, of course. Marcus was the representative of older adults who actually saved some money to buy maybe a 10-year refurbished laptop. And now they were on their way to their public library. That would be their connection. But with COVID, that public library, when it's shut down, they completely lost their entire connectivity. So Marcus is like, feeling a little isolated with a reduced network because of his age. Now couldn't find any way to connect with these. But then there was the other end of it that I'm going to come with the high socialization. But we were thinking people like Marcus, older adults like Marcus, who have low tech acceptance and use and low socialization, are the ones that need to be embraced, and we need to become the advocate for them to bring them back to better connectivity and also better socialization. How can we do this? Of course, there is the other end of the pendulum, right? Like in many things, like Mary Smith is another persona that our team have created, and that persona actually had the tablet and the smartphone, could connect, can do Zoom, was already active, like doing lots of volunteer activities. So we were finding that there were actually many older adults who have had career experiences, and they could be the ones who understand what their peers might be going through better than we do. So we could partner with those older adults, partner with Mary Smiths, so that we could help Marcus's much better. We have other personas that I'm not going to go into detail, but there is James, who might have not technology, but he might be in a good group, and then we might need to explain to him the benefits of him to pull him into the partnership side. We might work with Vivian, who might have with the technology, but maybe their network has reduced, and maybe they're just with family and limited friends. We could encourage them to become more socialized if we give them the right means and right technology. So after what we learned from the older adults, we turned to subject matter experts, and then of course they could give us the picture of the more complicated, this complex setting, what older adults might be going through. So we've spoken with 20 subject matter experts, and they've all given fascinating inputs. I'd like to share a few of them. Just like, I pay for internet, I dabble to pay for internet, that older adults have said. A couple of our experts from the get-go, they said, if you cannot solve affordable access, you just fish out of water. This thing will not take place. So on some extent, like some adults were arguing that, well, I need to put my hands on devices. But we were hearing from that if we think about device and the internet availability, broadband seemingly is becoming a more pressing problem, because most broadbands require spending over a long period of time. So, and that is something most older adults may not afford. Other thing is, truth be told, there are so many great technology resources out there. So what we were hearing actually, most of the service organizations were trying to put pieces together, and they were doing a very, very good job. But on one hand, it made us wonder, is everybody aware of what resources are available out there? Can we create a compository of these resources where everybody could tap into? And the final piece, of course, just like our older adults, what we heard from our experts was, they do need peer support. So we need to see older adults as getting interested in technology use and learning technology, digital literacy. It works much better if it happens in a social setting where they feel it may becomes a part of their social norms. So this reminds me of what William Gibson always says: the future is already here, it's just not evenly distributed. There are some folks who are really enjoying this and adapting, and there are some of them are really left in the dark and getting darker and darker. But let's think about this. In maybe 10 years, we will all get into our hands on some device. But then in that 10 years, maybe some folks might be enjoying artificial intelligence and or video, VR and AR solutions. And then again, there might be a group that might left in the dark. So we want to bring an equitable footing to everyone. So what did we find? We find that, as I said, internet access was harder than device. But we also find that the closer that those who work with older adults had a better understanding of their willingness and capability. They told us actually more interesting anecdotes about how older adults are engaging and even like giving up, and what really takes to keep them engaged, learning a new skill. And then simple devices are not enough. We need to have devices that are designed for use. And the peer support network, as I mentioned, could be a caregiver, a social worker who likes to go and just sit outside, 6 feet with the mask on and trying to teach an older adult goes a long way than any other program out there for older adults learn technology. But we also believe that the virtual programs work, and we work with we've spoken with Dartmouth Centers on Aging and Health, and they pointed out that it does work unless, if it is really paired with a caring and trusted party who might be teaching the older adults. So our challenge areas, and I should say our goals, are here in threefold. The first one is we do need to bring equitable access to technology. The second part is we need to build a services and support system to teach older adults, but also to be able to respond to their needs. And finally, we shouldn't forget, it's not a question of how, it's a question, why does social isolation exist, right? It's not like how can we mitigate it, but it's like why do we even have social isolation? So we would like to also see how can we improve interaction for older adults. So our perspectives on the project made us focus on these three aspects. The first part on the devices and internet, what we are finding is that older adults are actually surrounded by a support network, like family, friends, community leaders. In some cases, their community center might be their only support network, but that network is their collection and then could be the advocate to help older adults become connected. So we thought about who might be the best partner. So we did some stakeholder analysis, and our findings pointed out that we will have some key players, like those who are close to older adults and with the means, with the power, could help us to bring up organizations in the broadband providers and housing providers, so at least become advocate to build the conversation about how this could be done, and move the older adults, move these broadband housing providers to become key players in this setting. So, that slide, and we're happy to share the slides after the presentation. There are three pieces here, actually. One is those who are working with older adults could become the best advocates to understand their needs, to curate the content for them, and then to timely, effectively disseminate that content. So their partnership is very key in building this, bringing older adults and crossing the digital divide. The second one is we need to work with device manufacturers for affordable communication tools like up-to-date phones, but also they need to be designed for older adults. And the other piece is very important is how can we get internet service providers to ensure a subsidized and a long-term use of connectivity. And there are some tools out there are some programs that you could know about them, but we really need a systemic change that could come from the connectivity and broadband system. Are there programs out there? Yes, there are. Comcast, Verizon, Spectrum all stepped up during COVID-19, and they brought some programs. but it doesn't quite change the system, and it might be a solution for the next 6 months, but not for the next 1 year and onward. So what happens? Then we run into Housing Navigator Massachusetts, Everyone On, NOLO, these kind of organizations that are stepping in, trying to like chip in money so they could help, and they do great service at a time like this. But our perspective, like, what could be our guiding star? We could start with places like what's happening in Worthington, Massachusetts. A senior center is getting wired so that it could become the hub for older adults to use it. So we could start with key places that could get this connectivity in neighborhoods as well. But what is our future goal? This is Ammon, Idaho. It looks like any American city out there, right? But this city is connected with fiber optic all over, which brings internet as an utility. Now you might be thinking, well, that is a lot of money. Indeed, it's a lot of money. It's a work with municipality and the broadband service providers. But imagine if we could take this model and we could start with the fiber optic cable and the technology and just put it into certain centers. And then from these centers, we grow it. That could be a more systemic solution that we could propose. I think this is the type of conversation that we would like to have with you, and then investigate even further what really could be done, what would be a viable business model, so even internet service providers could step up to the plate. But it's not stopped there, right? We need to bring our older adults, we need to give them digital literacy and skills. So what we did was we looked around, we found OATS, you might know Senior Planet, Cyber Seniors, there are organizations in UK, they are doing phenomenal job of really helping older adults. There are Dartmouth Centers for Health and Aging that we've spoken with. They provide some service in their area as well. There is Tech Goes Home that provides these kind of services that to train older adults too. And then there are these organizations like the Concordium or Good Sempro. They don't quite do yet education, but they bring the platforms that could be promising as well. Of course, those platforms also live on the cloud, so we need to make sure that older adults have a phased approach to that. So how is that phased approach happening? Actually, organizations are really doing a phenomenal job. So let's not forget this. Friendship Work, Little Brothers, even Grove Hall Senior Center, Worcester Senior Center are all becoming very entrepreneurial in this setting. They are thinking, what do we need? How can we provide the same quality service we're providing now to our members, to our older adults? What do we really need to know? But the interesting question is, we are asking the same questions. Let me give you one. Everybody wants to learn Zoom. Everybody wants to learn Zoom. So everybody's making a Zoom video right now. So our call is that why everybody's working on that. Can we bring a centralized service and support that the service providers could identify? They could tell us what kind of communication solutions could exist. And then we could train the community outreach workers and other intergenerational volunteers to be not only technology brokers, because remember, older adults want to learn from their grandchildren. They want to learn from a trusted and caring party. Can we train our volunteers both to understand how to help older adults? And then I can see, particularly starting with simple things like FaceTime or Zoom conferencing, we could get older adults and break the barriers of them feeling a little bit uncomfortable with the technology and open it up for them to learn other things, which brings me to my other point that with this organization we built with virtual programs, ongoing support, now we could start looking towards improving the social interaction, which is why we are here in the first place, right? To not necessarily mitigate social isolation, but to increase social engagement for the older adults. So what can we do? My holy grail is here. Can we do social engagement by older adults and for older adults? I've seen examples of older adults running successful Etsy businesses. Can we do this by giving them these skills? So older adults could indeed have to stay connected to their senior centers and religious organizations. We would like to keep them there. And but we would also like to create a connection between Mary Smith and Marcus Williams. So Mary Smith could find ways to connect with Marcus, and Marcus could find ways to connect with Mary. And we can develop support programs that older adults would be most interested to join. And we're seeing that when their friends are there, when it's a social engagement, of course there is more interest. That was one of our findings, that there's a big social influence component for older adults to take these technologies. There are, again, a lot of current and developing product service solutions. So this is a great space to be an entrepreneur as well. We're not quite seeing the at the cost point, but AI and other technologies, voice activated technologies are also developing as well. But we need to figure out a way to bring their price point so that it could be a more usable item for accessible item for most older adults. And I like to also give a shout out to ARRP's The Hatchery, an agency at Cambridge Innovation Center, who are doing interesting work. And if you're interested, feel free to visit their websites. And they're constantly harboring new talent and new entrepreneurs with ideas helping older adults. So in short, I know I've said many things, and I believe I would like to leave you with, we do need a systemic solution to this. If you would like to envision this solution to go away, the problem to go away, which is social isolation, we would like to find a way, like Emmons, Idaho, how can we engage private partners? So that's one, coming from a business school, that's one question I'm very curious to find an answer for. But also for those out there, we need to come together and co-create new ideas, like community providers, COAs, social workers. Who is already doing what? What essential skills are needed? What are we already doing? What can we share with our community? That also, I think, helps everybody out there trying to figure out what's the best and available resource today. And finally, not to replicate our efforts, we need to develop this centralized service and support model with the older adults, understanding their needs, and particularly creating we don't only need technology solution or technological brokers. We need people who understand older adults' context and then try to be helpful to them. So with that, I'm going to stop right here, and I'm happy to take other questions if need be. Thank you.
Thank you, Professor. That was a lot of information in a very short time. Let's turn for a minute to our community partners who, if you could turn on your cameras and come up on the screen, I will introduce you. So first we have Cynthia Wilkerson, who's a program director at Little Brothers Friends of the Elderly. You could wave maybe so people know who you are. Julie Berkeley, who is a director of programs at Friendship Works, and Commissioner Emily Shea from the Age Strong Commission in Boston. And James, you might want to join us too, and Sanan, I'd invite you to come back up. So what I'd love to ask each of you community folks to do is to take a minute to introduce yourself and tell us about your organization and the work that you are doing currently to address the digital divide. And if you can reflect on some of the principles that Sanan shared about accessibility, sustainability, affordability, and equity, that would be terrific. So Cynthia, could I start with you, and we'll do a little round robin here, and then we'll open it up for some questions.
Sure, thank you. And thank you, Sanan, for that wonderful presentation. I had the opportunity to speak with Sanan this summer, and it's really fascinating to see the product of those conversations and that thinking and that deep listening that the Babson team obviously engaged in this summer. And I also want to thank the organizers for inviting me to speak today. I'm Cynthia. I'm the program director at Little Brothers Friends of the Elderly. And since 2015, we have focused primarily on intergenerational programming in Boston. Tech literacy has been part of our work since then because intergenerational work and technology really intersect very nicely. Digital natives and digital immigrants are great companions. Since the spring of 2020, tech access has taken on a new urgency. Working with the Age Strong Commission this spring and summer, we've distributed internet-enabled tablets to our participants, and we've shifted to an entirely virtual model. We've made tech training and support a component of most of our online intergenerational sessions. And our participants run the gamut of individuals, as Sanan was suggesting, run the gamut of individuals who are connected and were online well before March of 2020 to folks who had never picked up a tablet before our summer or fall sessions. Older adults, like all tech users, need connectivity, affordable and reliable devices, and tech training and support that is accessible and respectful. I think we've all been on the end of a tech support call not feeling very respected. And I think that's a really important component of engaging new users and making sure people know that they are competent and capable and able to learn whatever new technology they're looking at. The need for tech access won't end with the COVID-19 vaccine. We need long-term investment and commitment to internet access across the Commonwealth. Adults are aging in with their devices in hand. We all need affordable internet. Older adults, just like families and students and younger adults, need internet access. And my byline for today is, we can build an age-friendly tech coalition to advocate for connectivity for the Commonwealth. Thanks.
Cynthia, I love that aspiration. So I'm going to hang on to that, hold that in my thoughts as we go through the rest of this afternoon. I do want to remind people, I neglected to mention that this is being recorded. And if you do have questions, please use the Q&A function. Julie, could I turn to you to talk
Sure.
about what Friendship Works has been doing?
So I'm Julie Berkeley. I'm the Director of Programs at Friendship Works. Our mission is about ending elder social isolation and improving quality of life. Our traditional model has been to use volunteers to work one-on-one through friendly visiting, medical escorts, friendly helping, as well as some group activities in nursing homes and assisted livings. Since COVID, that has changed, and we've really had to pivot our friendly visiting program, which touches over 700 elders a year, completely virtually and online. And while we have done a lot of our work on telephone, we obviously have been very interested since the spring in really figuring out how friendly visiting can happen with video, and also what other kinds of programming and support and connection that really builds connection we can provide. I'm really excited about this today because this has been a really hot issue for us. We have elders who live in all kinds of buildings. They're not in just a few buildings all over the city and greater Boston area. And what we probably have more of our elders who fall into the explain category, or even a little bit sub to that, where we have elders who don't even really understand whether they have internet or not, or whether they have a smartphone or not when you ask them these questions, or who don't know what swipe means on devices. So while we do have some elders who are really quite savvy, we also have a lot of elders who really are at the very beginning stage and could not access a Zoom call for further education. So for us, a lot of what we've been trying to do is really, we just distributed a survey, mailed out this fall a survey to all our elders, asking them some questions about their internet access and devices and interest in learning more. And we're hoping that we're going to get a good response rate back. We've also been calling elders and integrated these same questions into our intake process for new elders that come in. And then really, we've also received wonderfully tablets from the Age Strong Commission that we've been able to distribute to elders as well. And we've been piloting providing some tech coaching to elders who have devices and internet, providing one-on-one coaching over the phone. And now we're starting to recruit some volunteers to do this work. We've also dabbled in doing a phone/Zoom concert and some other activities, but we've really shifted on first well, there's a lot of content out there we could connect our elders to. I think the internet access, affordable internet access, is just the #1 issue that we're seeing.
Thank you, Julie. Someone had asked what communities Friendship Works serves. So can you just jump
Yes.
in and answer that question?
Our friendly visiting program serves all of Boston, Brookline, Newton, Cambridge, and Somerville. And our medical escort and friendly helping programs focus on the city of Boston and Brookline.
So our speakers today are a little Boston centric, which at first I was concerned about, but I think the benefit of it is that it gives you a sense of how all these organizations are working together to address these issues. So Emily, can I turn to you and can you talk a little bit about this from your perspective from the Age Strong Commission?
Sure, I'd love to. And first, I want to thank Sinan and his group at Babson for all their fantastic work. We're looking forward to digging into it even more and using it to help us shape what we do here at the city. And great to be here with all of our other partners. So we really obviously take this as a really important issue at the city. I think it's critical to tackling social isolation with older adults, and also making sure that they can live safely during COVID and have access to what they need in order just to kind of basic needs in their life. But I'll tell you a few of the things that we've done. So we started off doing a tech survey with a lot of our partner organizations throughout the city. We sent that survey out to housing providers, to religious organizations, to immigrant serving organizations, aging organizations, and neighborhood associations, because so many of those are working to touch our older adults out in the community in all different ways. And so we got a lot of great information back to them, nothing that anyone would be surprised about. It's like, the three-legged stool. Folks need access to the device, to the internet. And we saw a significant number of people saying that that a lot of the older adults that they work with would need access to training and technical assistance as well. So I love the idea of kind of that help desk kind of a thing. We also, in partnership with our Department of Innovation and Technology, which we call Do It here at the city, we're able to get access to about 575 laptops with a modem that was paid for a 3-month period of time. And we were able to get those out to a lot of our grantees and our partners that are running our senior centers throughout the community, specifically kind of with a target of making sure that they could get people on and continue to engage with those organizations. And then you've heard from Friendship Works and Little Brothers Friends of the Elderly, really also targeting our Older Americans Act grantees that focus on social isolation, so that they could continue to do their work in a different way. We also have identified additional resources that we're going to be putting into technology access, and we're figuring out what that looks like now through some of our CARES Act funding. So thank you to Elder Affairs and our federal government partners for that fabulous opportunity. We are hiring a technology position here at the commission. So we see that position as somebody that can help to bring what we're learning and what our partners are learning together, because we're all learning new things every day about how to improve the work that we're doing with older adults and technology access. And I think there's a lot of shared learning that can happen, and we have some spaces for that. But there are a lot of people that want to be involved in that conversation. So how do we help to facilitate that and make sure that we're not recreating the wheel when someone has already created it? And then finally, I want to say we're looking at this at the city really as an equity issue, as a human rights issue. I was sitting last night listening to our Human Rights Commission meeting, and technology access was the focus of that. So it's really so huge, not just for older adults, but also for pretty much everybody that doesn't have access in the city. When you think about, certainly we've all heard a lot about our students and families that don't have access, but when you think about people in recovery and joining recovery groups, or people in ESOL classes, all of that has had to shift online. So we're really thinking about this very broadly at the city, and trying to think what we can do to make sure that people who need access have the easiest time getting access that they can.
Thank you. So what I'm hearing you each say is that this is not one challenge, but at least 3 or 4. There's the challenge of hardware, right? How do you get people equipment if they don't have it or they can't afford it? There's the challenge of connectivity and making that affordable, to Cynthia's point. Then there's the challenge of confidence and competence, and not being defensive or scared to use the technology, which is the point several of you made about helping people improve their skills, having a help desk, having people teach other folks. So if we think about it in those kind of 3 buckets, James, I wonder if you have thoughts on where people find nickels and dimes and sources of funding to be able to approach some of these challenges, if not all of them.
Well, as sort of the self-proclaimed master of reframing different funding opportunities to make them age and dementia friendly, we've found a few different sources. Communities themselves have used community development block grants, and worked with, between councils on aging and libraries for tech loan programs. There was a recent opportunity for, I think you mentioned the Community Compact IT grant that we were at least promoting communities use to hook up affordable senior housing with internet access. But the issue with that was different municipal departments get to put in their IT needs, and it didn't always rise to the top. So there was that issue. But the governor has an economic development bill with, I think, around $9 million for internet access for low income populations and other groups. So there are opportunities that are still coming up, but we're being creative in finding funding, and communities are really finding finding funding. That was a tough one. In by local community foundations, partnering with the business community. There's not one solution. I think there's a set of solutions, and it might depend on where you are in the state.
So Sinan, just to follow up on this a little bit, if you're thinking about this from a broader perspective, a lot of sectors stand to benefit if more people are engaged in technology, whether it's the local shoe store or the purveyor of, fine wines and spices, whatever it is. So can you talk a little bit about other kinds of partnerships and other visions you might have for how we start to make progress on all of this?
I think it's a great question, and I think, Robin, it really puts it that we cannot solve this by just trying to do patchwork at the system that we have right now. We need to step back and see how this is going to impact the entire ecosystem, meaning that if we build this connectivity, how it really changes game for financial industry, healthcare, retail. Like we're finding that, and actually our group was thinking about this, and what if you give older adults access to Amazon, what it means for Amazon, that Amazon has not yet probably experienced that level of rise in consumership. Similarly, in the healthcare space, what it means, like if we give older adults connectivity, what it means for healthcare costs, for reducing unnecessary visits by the older adults. So we just started looking at this from the isolation perspective, and isolation is important because it is a social determinant of health, and it does reduce healthcare costs in the long run as well. But we also looking at this as all the possibilities that older adults could generate. And when we were starting our conversation, older adults having better means could shape the narrative around technology and what technology could achieve. And we were seeing that more and more, and our belief in that has increased as we went longer and more deeper in this project.
So I'm thinking back to Cynthia's point about how we really need a coalition to advocate for affordable internet access. And one of the participants had written in a question asking for our thoughts on how we begin to define technology access as a critical social determinant of health and essentially a right. So do people have initial thoughts on that? I realize that that is a very broad question, but If you could do one thing to begin to change that conversation and move it in that direction, what comes to mind? You can just all jump in, James.
So I kind of alluded to it when I was rambling at the beginning of this whole operation, but I think adding it as an issue of focus to the age and dementia friendly framework. I don't know who is in charge of pulling the levers of determining what's a social determinant of health or not, but I know that we control our framework and how we communicate to communities and stakeholders. So I think if we're talking about technology as an age and dementia friendly domain, I think that's what we can do in the short term and the immediate, really, to advance the subject.
Emily, not to put you on the spot, but how does a large city like Boston or any other city in the country think about this and making progress on this?
Yeah, I mean, so I would say that we're still I kind of developing some of that, Robin. I mean, we certainly have a framework we're going by, but a lot of the details need to be figured out. There's obviously a resource issue. I mean, really, we want internet and access thought of as a utility, right? It's the same as a telephone. It's the same as, having heat in your home. You really just need it for basically all aspects of your life, especially if you don't have the ability to get out as much and to get around. And so I think it's thinking about it differently and figuring out kind of what is the strategy to get everybody to think differently about it, and then what needs to happen kind of on the federal, the state, and the local level in order to move that work forward.
Okay. So Julie, did you want to add one thing?
Yeah, I was just going to add, I think part of the long-term solution also has to be bringing in and looking at the financing mechanisms for affordable housing and elderly housing, as we want to bring tech access and internet access as a utility. We have to start with building into the financing mechanisms of those projects. That is a much longer term solution, but I think it's really critical in terms of a stakeholder that needs to be brought into the conversation.
It's a great point. So we have about 4 or 5 minutes left. So I'm going to do kind of a final lightning round. You each get about 30 seconds to answer this question. So based on everything that we've learned and experienced, if we reconvened exactly a year from now, what would you hope you would be able to report on as progress, or what would you hope that this landscape looks like? So I'm not talking 5 years out, 10 years out. We're not going to boil the ocean here, but a year from now, what would you like to be able to report back and say, look at this?
So on my end, I would like to be able to make the business case for the private organizations out there, what it means to invest in internet in the affordable housing communities. And I would like at FutureLab to take up on projects that probably make that case, when this is going to be through what kind of partnerships, through what kind of financing, that this could indeed happen. So hopefully we could have a project that could be our proof of concept, and from there hopefully we could scale up.
Okay, I'm going to hold you to that. Other thoughts?
So we're already part of a couple of groups, including one at AARP that's looking at technology access, digital divide, and so on. But I think in a year from now, what we'd like to do is bring together some of our key partners and others, including schools, housing, libraries, and other parts of the community where that this has an impact as well, and try to address it, as Sinan said, as a community, so that we're not looking at solutions for aging services or for schools and so on. It's that we're all on the same page. So that's what I would go for.
Okay. Cynthia?
I would concur with both of those visions, and hope that a year from now, older adults are squarely in the midst of any conversation about digital equity, not an afterthought.
That's great. Julie?
I think that I would like to see that there is some centralization of providing the educational component and one-on-one coaching around technology for older adults, as well as a better understanding of the landscape and sharing of that information. For example, in large property management companies, which buildings have access, which don't, rather than trying to go building by building and trying to figure things out. And there being more support of those building staff to be able to help for groups coming in to do actual content so that they could help set up a projector and a screen outdoors, and you could socially distance doing it more support or programs.
Mm-hmm. Thank you. Emily?
Yeah, so I think in a year's time or so, I'd like to, and I think we will get there, have kind of a citywide plan around digital equity, and have older adults kind of having a piece in that plan and an active role in that plan. I think that to successfully roll out a plan, it's going to require resources. So that's going to be a piece that we need to figure out. I'd love to see more funding coming. For us as the Area Agency on Aging, I'd love to see more funding coming for area agencies on aging to tackle social isolation and tech access. And I think that there are some bills in Congress that are focused on that. So I think that would be wonderful, and also that we continue to work collaboratively with our partners and all learn and share together, I guess, so that we're not recreating the wheel, and by being together on this, we can all do so much more.
Thank you. I love the combination of everyone's aspirations tempered by a dose of pragmatism and realism. It's really a great balance. We are at time. Several people have asked if they can get copies of the slides. Absolutely. Those will be posted on the Massachusetts Healthy Aging Collaborative website, and then anybody who registered for the webinar will receive a copy. As I mentioned, this has been recorded, so that will also be posted, and you can rewatch it or share it with your colleagues. I want to thank all of the participants who registered for this, and then especially thank James, Sanan, Emily, Julie, and Cynthia for joining us this afternoon and sharing their expertise. We'll close out on that note and stop the recording. And we did mention that we will stay on for a few moments longer once we turn off the recording in case people have any questions or want to have any conversation. Thank you very much. Have a good afternoon.